Thanks so much for joining us. You are in concurrent session A, innovative models to promote aging in place in social housing. So we're really pleased that you're joining us today. I am here. My name is Emma Helfin Green. I work at the City of Toronto and I'll be moderating the session today. So I'm just going to introduce our first two speakers. Andrea Austin is the manager of senior services at the City of Toronto. And Jill Batta is the general manager of the seniors housing unit at Toronto Community Housing. And they will be speaking about their model and then we'll have another presentation. So I'll ask that Jill and Andrea join us up here and then we will go through their presentation. Thanks so much, Jill and Andrea, for being here today.
Great. Thanks so much, Emma. Jill and I are delighted to be here today to discuss a new seniors housing service model that's being rolled out across community housing seniors buildings. So next slide, please. Just wanted to take a moment to step back and look at the efforts that the City of Toronto has made to become an age-friendly city over the past decade. So we have worked with seniors and other partners to co-design, co-implement, and co-evaluate the Toronto Senior Strategy. And we've taken a number of actions to move our city towards an age-friendly, age-inclusive, and ultimately an age-equitable city. So a few highlights here on this slide. In 2011, Toronto City Council directed staff to work with partners to develop a plan to address the dramatic increase in the number of seniors living in Toronto. And that motion from council landed on my desk, and I have been tremendously fortunate to work in this space ever since with, as you can see, incredibly creative and collaborative partners. So that resulted in the first Toronto Seniors Strategy in 2013 with 91 recommendations to move the city forward. And we didn't just come out with recommendations and then not follow up. Every single year, there's a public progress report that outlines exactly for every recommendation, whether it is fully implemented, partially implemented, or not at all implemented, and why. So if anyone is interested in getting those reports, I'd be happy to provide them. So then in February of 2016, Toronto officially became a member of the World Health Organization's Global Age-Friendly Cities, and that international recognition has been renewed annually since 2016. And then in 2018, building on that initial success, the City of Toronto approved version 2.0 of the Toronto Seniors Strategy, which again was co-created with seniors and partners and based on consultations with over 10,000 residents. So there was a survey that reached 7,000 and there were 3,000 mainly seniors and caregivers that were reached in in-person meetings, 91 meetings across 44 wards. And then the second strategy lays out 28 high-impact recommendations across health, housing, transportation, employment, income, and access to services, and all of those within the purview of municipal authority. So things like social recreation programs, community paramedicine, digital literacy programs for seniors in libraries, park benches. We installed over 1,200 new age-friendly park benches, public transit training programs for specifically designed for seniors, and many, many more. And all of that has laid the foundation of where we are today, which is moving forward with a new and responsive model of senior social housing. So next slide, please. So in terms of setting the context, Sander covered much of this in his deck and in his presentation. So maybe I'll just add a number of things. So of the tenants in Toronto community housing, 90% pay RGI or rent geared to income, and then the remainder of the tenants pay market rent or affordable rent. So, and then RGI is 30% of gross income. So that's what occurs now. But as of July, it's going to move to 30% of net income. And the wait list for social housing is managed by the City of Toronto. And the median income for Toronto Community Housing RGI households in general is about $18,000 compared to Toronto's median household income in 2016, which was roughly $66,000. So next slide, please. So why a new model of senior social housing? So as demonstrated by those earlier slides on the City of Toronto's actions and efforts to become more of an age-friendly, age-inclusive, and ultimately age-equitable city, this is a high priority for the city and an important priority population for support and services. So in July of 2017, the City of Toronto approved the Tenants First plan to improve Toronto community housing. And this was a plan to ensure that TCHC focused on being a social housing landlord, where buildings are in a state of good repair, that tenants are connected to appropriate services, and remain active, engaged participants in their communities. So our research partners, as you heard earlier, Dr. Christine Shepard and Dr. Sander Hitzik, they spoke more about some of the particular challenges faced by senior tenants in those buildings. So I won't go into the detail here. We wanted to focus more on the implementation of the new model, which is based on the Tenants First initiative. Next slide, please. So Christine talked about this as well. As part of looking at improvements to the seniors portfolio under Tenants First, and from engagement with tenants in the seniors buildings, we heard a lot from senior tenants that they want their units and buildings to be well maintained. They want to feel safe in their buildings and in their communities. They want to be connected to programs and services that meet their interests and needs. And they want more frequent, proactive, and respectful communication with the building staff. So that engagement that was led by the grant that we were able to get with Dr. Sander Hitzik and Dr. Christine Shepard that you heard about earlier helped us to gain an even deeper understanding of the needs and opportunities to better support senior tenants. So next slide, please. So based on the review and research conducted by our academic partners and tenant engagement, we understand that seniors face challenges and barriers in accessing services. So things like challenges associated with declining mobility, increasing vulnerabilities related to anything intersectionality-wise with respect to being racialized, or LGBT tenants not speaking the language or it not being the first language, et cetera, kind of persistent poverty, increased isolation, and those types of factors. So based on that, this new service model was developed called the Integrated Service Model, and it aims to better integrate housing and health services for senior tenants. It was developed by the City of Toronto, Toronto Community Housing, provincial health partners, and others. And the new approach is designed to promote aging in place, designed to promote improved wellness for senior tenants, and successful tenancies for senior tenants. It is a geographical and building-based model. So it has, so there are specialized roles and increased staffing at the building level. And it focuses on partnerships with health and community service providers built out from the building level. And it's very specific to the needs of that particular building. It's also designed to enable and facilitate better communication between staff, tenants, and service providers, and in particular between housing staff and health staff. And it's also another impact, or another intended impact, is that there be cleaner and better maintained buildings, that there's trust and rapport between tenants and staff, that there's building-based support and services and better access to those building-based supports and services, and that there's better coordination with the partners like health and social and community services, and that overall there's proactive interventions to address problems early on. Next slide, please. So the ISM is being rolled out across 83 seniors designated Toronto Community Housing buildings. And this allows us to learn and to continue to improve on the model as we implement it. And the initial implementation began in December last year in the Southeast Toronto in 18 buildings. And the full implementation is expected by the year 2022. So I'm going to now turn it over to my colleague, Jill Batta, who's the General Manager of Seniors Housing at Toronto Community Housing, to discuss the components of the model in more detail. Next slide, please.
Thanks so much, Andrea. So the ISM has three key innovations. The first component is our new staffing model that creates a new tenant-facing support role with reduced staff to tenant ratios and offers advanced training to staff and senior-related topics. The second one is a revised senior-specific housing policy and practice exercise, which will review and look to better respond to the unique housing challenges faced by older tenants. And the third is a designated care coordinator role. These are funded and employed through the health sector for each building to connect tenants and with health and community support services. So let's take a look at each of these in a little bit more detail. Next slide, please. So the new staffing model sees an increase in staffing levels across all seniors buildings, with staff assigned to specific buildings. We're also expanding training for staff on topics relevant to seniors. So far, we've offered training in areas like mental health. There's upcoming work and training going on with related to suicide prevention and cognitive impairments. We're also working with partners like the city and others to offer other ongoing training opportunities, such as services that are more relevant for seniors and the senior population. We're hiring new staff in tenant-facing positions, and that's been underway for some time. One of the new positions combines two previous roles, one which was supportive of tenants and their tenancy-related issues, such as annual unit inspections, arrears, etc. And the other was one which connected tenants to community supports and assists with community development. The idea was to have one single role that would be a point of contact for all tenants, so they know where to go to access all types of supports. Since December of 2020, we have hired 15 staff across a number of new positions and existing positions to be able to provide overall ISM support. Next slide, please. As part of the ISM, we're also reviewing all of our policies and operating procedures, as I mentioned. We're applying a seniors lens to our existing housing-related policies and practices to ensure that they meet the needs of seniors. And we've developed new policies that will support and enable the integrated service model. An example of the new policies in development include a new referral process between housing and health teams and partners, a tenant needs assessment for housing staff to conduct with tenants to proactively identify concerns or challenges that they are facing and connect them to the appropriate supports. Tenant engagement is critical to the development of these policies. And so we're working very hard with our partners and the city, as well as getting feedback to make sure that we're looking at the ones that are most important. Next slide, please. And finally, through our partnerships with the provincial health sector, we've designated care coordinators who are employees of the provincial health system to bring specific building supports. These care coordinators will assess clients, determine eligibility, and connect tenants with home and community care supports. They will also work closely with building staff and participate in joint training and site meetings with our staff to identify tenants who may require additional supports. So far, the care coordinators have been assigned in the first region in the southeast of Toronto. Next slide, please. So what would success look like? Well, our goal is to support our 14,000 senior tenants to age in place with comfort and with dignity. We are working with the city and seniors tenants to evaluate the model through indicators and surveys and to make adjustments as necessary. Some specific measures that we will use to evaluate the integrated service model is a tenant experience survey. We'll be looking at our evictions information and data, our arrears data. We'll be looking at safety incidences such as contact and interactions with police, fire, and paramedics. We'll be looking and working on referrals to community supports, how home care plays a part in our clients' experience, and also looking at non-urgent emergency department visits, just to name a few. Next slide, please. So far, the ISM has rolled out in 18 of our 83 buildings, starting with the Southeast region. And we continue to learn from our early experiences, which is why we are rolling out this new model in a phased approach. Some of the lessons that we've learned so far is that it takes time to recruit staff with the right skill sets. For example, our new senior services coordinators. On-site staff can make a meaningful impact by being present, engaged, and responsive to tenants. Meaningful tenant engagement requires dedicated time and resources, and we know that our ongoing engagement efforts have lots of room to improve and be enhanced. Benefits of academic partnerships for evaluation and engagement support have really made a huge difference to us. As you will have heard this morning's keynote speech, we benefited greatly from our partnerships with Dr. Christine Shepard and Dr. Hitzig. We value those strong partnerships. Our community and health partners are absolutely critical to the success of this model. And we continue to learn as we roll out the model across our portfolio of buildings. Next slide, please. So looking ahead, Toronto is taking further steps towards dedicated seniors social housing. In 2019, Toronto City Council approved in principle the establishment of the new Seniors Housing Corporation, distinct from Toronto Community Housing. Work is underway to establish the independent corporation. It will operate the 83 seniors buildings and will have dedicated focus on providing seniors housing through the delivery of the integrated service model. TCHC will continue to own the properties and manage the capital improvements of those buildings. The board has been appointed through last week's council, and it does include 2 senior tenant representatives. The new corporation will provide opportunities to continue to provide new and specialized seniors housing. It's such an exciting opportunity and a next step forward for the City of Toronto on our path to creating an age-friendly city. Next slide, please. So we're going to switch gears for a minute or two, and I'd just like to speak a little bit more about our response to COVID-19 in our 83 seniors buildings. And as you can see on the screen, these are just a couple of photos that represent the hard work of our staff, our tenants, and our partners. Next slide, please. In the seniors housing unit at TCHC, we've taken an active role to try and support our tenants throughout COVID-19, many of whom have been extremely isolated. We have undertaken several activities. We've done telephone and in-person check-ins for all 14,000 tenants. We've distributed over 46,000 disposable masks, 2,000 reusable masks, and COVID-19 prevention information to all tenants. Along with other community partners, they've supported these efforts. We've distributed approximately 4,500 meals across buildings in partnership with MLSE, Maple Leaf Sports, and regional social service partners. We've delivered door-to-door flu vaccinations and offered 9,700 tenants in 55 buildings the opportunity to be vaccinated in their own building with the help and support of our regional health partners and social support teams. We've held 6 door-to-door COVID-19 testing events, facilitated and offered to 1,738 tenants, and out of that, 1,044 tenants were tested. And as of April of 2021, the first dose of COVID-19 vaccinations were delivered in 69 of our 83 buildings, with a total of 6,000 tenants that have been vaccinated. Outreach was conducted to approximately 12,000 tenants. In addition, all seniors housing staff have been provided the opportunity to be vaccinated as well. And this has been made possible in partnership with the Ontario Health Teams, affiliated hospital, and other non-for-profit agencies. So what have we learned from this experience? Well, we've learned that there's a critical importance to our partnerships and relationships with the health sector, and the benefits of providing services directly to buildings through those relationships, and the need to be able to have things like translation and volunteers that speak language in our buildings and offer different languages to our tenants. The pandemic has actually helped us expand and enhance our existing partnerships with the healthcare sector and has facilitated significant learning in support of the integrated service model. Next slide, please. I think that's the end of it. And so I will pass it back for any questions.
Thanks so much, Jill. Really appreciate that. And thanks so much to Andrea for starting us off. We will actually turn it over to our next presenter, and we will take questions at the end. If anyone wants to just think about those and put them in the Q&A, and we can get to those. So thanks again, Jill. Andrea, it was a wonderful presentation. It's great to also hear about all the work that's been happening on the COVID response. So our next speaker is Shanika Donald, and she is the Director of Client Services at GEF Seniors Housing in Edmonton, Alberta, and she's going to be speaking about some of the work that they've been doing to support seniors in their housing programs. So Shanika, I'll welcome you to the stage to speak about your work, and then we will do some Q&A at the end. So thank you so much.
Thank you. Sure. Just getting the tech. Okay. Hello, everyone. So at GEF, we've always been a senior servant organization in terms of seniors housing, and so we've been around for 62 years now, and we are the largest provider of subsidized seniors housing in Alberta. We serve approximately 4,000 seniors in two sets of across two housing programs. So one is our apartment buildings, and the other one are our lodge facilities. And our apartment buildings are independent living styled apartments that are geared to those who are more functionally independent, who can manage their day-to-day, and our apartments are rent geared to income. That we have a few of our buildings that are more they're affordable, so they're about 30% below market as well in the stock of apartment facilities. The lodge program, on the other hand, is more akin to, I believe, retirement type facilities. So in these facilities, seniors are provided with once weekly housekeeping, meals, and engagement activities throughout the day. This is also calculated a rent geared to income, in addition to support fees that the residents pay. So when we look at our population, the average age for seniors in our apartments are about 74 years, while in our lodges, they tend to be a little bit older at 83 years. What we have seen is over the last 3 to 5 years that our tenants and our residents are coming into, whether it is the first time they're coming in directly into the lodge or into the apartment program, they are coming in at a later age. So they are staying in their homes longer, or on the other hand, accessing seniors housing later. So when we look at age supporting aging in place, for us, there are some contextual pieces that we're mindful of, and we have to recognize that as we are trying to effectively support our residents and tenants to age in place, that there are limitations to what we do, or areas that we will have to navigate, not so much limitations. And one of them is infrastructure. So for us, in our apartment program, about a third of our apartment program those buildings are over 30 years old. So obviously they were built in a particular time and with a particular design, where the seniors who were accessing those facilities were coming in younger, and therefore not with the level of health acuity that we're seeing now in some of our clients. It's about the same for our lodges as well, that the time that they were built. So what we're seeing now is that in our population, we have I think in the last 10 years, we've seen a significant increase of clients who are using like aids to daily living and other supports, needing to access other supports to support them from a healthcare perspective in the buildings. That presents a challenge because when infrastructure wasn't built in a time when people were utilizing these. So on one hand, the ADLs are helping the seniors to be more independent, but there's the infrastructure tensions that exist because the buildings weren't necessarily designed with those things in mind. Over the years, we've done modifications, but there's always a tension between the extent of modifications and the age of the buildings. And so as we look to support our seniors aging in place in our buildings, we adopted a quality of life philosophy. And it was from the perspective of, we recognized that our residents and tenants were moving in at a later date, but it was still very important that we were ensuring that they had safe, accessible, and affordable housing in environments that could promote their independence, their continued independence. And so what I will focus on two of the programs that we have here going on to support that. So one programs we focus on is our activity and wellness. And our activity and wellness spans both our apartment and lodge programming. And so the intent of this program is to provide clients with meaningful activities that provide opportunities for them to engage with each other and develop a sense of community. And we know through research that having a sense of belonging is often correlated with positive physical and mental health outcomes. So we work with the seniors to provide those opportunities. So they identify these opportunities. They are the ones who can sometimes lead the activities or the initiatives. So for example, in our apartment program or tenant monitoring program, which is a daily check-in, it is purely run by tenants. None of our staff are involved in that. And so that helps them to get opportunities to meet each other, but also to create that sense of community. And so also where our residents and tenants identify opportunities for new types of engagement, we also facilitate those connections if it is that they're external programming that could support them. Our other program that we have is our community support program. And so in this program, we actually employ outreach workers who assist in helping our seniors, whether it is that they need to make adjustments because of transitions in life events, or they need to be connected with resources that are external to our organization, or they need to have an advocate for their housing. The outreach workers are the ones who facilitate this process. And this program, we developed this program because one of the things that we know is that the sooner we're able to, one, connect with our clients, the earlier we're able to connect with them, the better we're able to work with them to stave off or to mitigate more long-term impacts that they may be having because of challenges that they may be facing. So whether it is around someone not having all the right benefits because they've not been applied for, and that can have impact on their finances, which then has impact on their ability to pay their rent, get food, all of those things. So the outreach workers work with them to to navigate those external systems to access resources. Through this program, because we have close to 4,000 staff, residents and tenants, and we're very mindful of, we at this time only have 4 persons on the team. We work very closely with external partners to, and that could be whether partners who are operating other senior centers, who they also have social workers who can support our residents and tenants, or with the health sector. So our partnership and navigating those partnerships and continuing to build those partnerships are integral to us being able to support our residents and tenants, because we recognize that it's not feasible for us to do it all on our own. So as we support aging in place, for us, it's very important that we ensure that we engage our clients. So whether it is through our annual resident, tenant, and families of the residents survey that we send out annually, or to ensuring that we are communicating the various changes that are happening, whether it is through, as a result of some building related infrastructure type issue, or changes that may be happening with our staffing, or whatever is happening with them in the building, or celebrating good things that have happened in the building as well. We ensure that we're always engaging with them, we're communicating with them, and we're also providing them with opportunities to provide feedback to us. And so we're also ensuring that in terms of the supports that we put in place, so whether it is through our activity and wellness program or community support program, all of this is by choice. So if a senior wants to move, has moved in and they're not interested in getting involved, that's okay, but it is available to them. And so we are very respectful of choice and the seniors' ability to choose. But what we've also seen is that as we've supported the seniors, they have become almost ambassadors of, whether be it the community support program or the activity and wellness programs. So if a senior is through their connections with their neighbors, see someone who is struggling, they will pass on the card of the outreach worker to say to their neighbor, no, call Denise, because she'll help you to navigate this, which for us has been that much more valuable, because it speaks to the trust that has been built in the relationship that we have with our residents and tenants. So as we have, in the last year, the pandemic has impacted many of us, and for us, it has increase the need for us to identify new and renew or identify renewed ways of working with our partners, because one of the things that we became aware of very early in the pandemic is that the needs that our residents and tenants had did not disappear with COVID. In fact, they became much more pronounced. And so we had to ensure that our staff or outreach staff was more accessible. And so we were finding new and different ways through technology of connecting with our residents and tenants. One of the things that we were very mindful of was that because our lodge residents in particular, which is about between 900 and 1,000 seniors, were impacted by the chief medical officer of health orders, because we were pulled in with long-term care and designated supportive living in terms of how we had to respond to the pandemic. There were restrictions put in place, so families couldn't come to visit as much. And so we had to quickly do those shifts with both our staff as well as so that they would be more available to help the residents and tenants maintain those connections, because we recognize we do know the importance of those family connections for our residents, in particular, who would have been impacted by these restrictions. And so we've implemented technology-based programming. We have over the Christmas, in particular, the holiday season, we sent out messages to all the families, and we had families who were reaching out and contacting their family member from as far as Australia. And it was interesting because then they were saying that while they would talk with to actually be able to see them over whether it was Skype or Zoom, we were able to set up family gathering where they had meals together, and the senior would be eating and their families would be eating remotely over technology, virtually, I should say. And so these programming we've been able to help our residents and tenants remain connected. When the restrictions were implemented and there were limits in terms of the numbers of persons who could gather, we shifted the majority of our program to virtual programming. So whether it was exercise programming, and we, where possible, streamed it directly to the residents' room. The tenants participated a lot in virtual programming, where we were able to pull in volunteers to run programs. So they had meditation online, they had exercises virtually, they played bingo virtually. So we were having a number of engagement, so that the seniors, where they couldn't connect with each other, were still having a level of connection. We also, in the last year, introduced our new pet policy, where we started to allow residents and tenants to have pets. And it was a crazy time to have it, but it was immensely beneficial to those seniors who wanted, or those seniors who were moving in and had already had an existing relationship with a pet. And so to not break those relationships because they were moving into seniors housing, we made that pivot. And so we continue to look at how the pandemic is impacting our clients and to identify ways to support them through this time. And we've also seen where a lot of our activities that we've implemented, we're not going back on them. So we would never go back on virtual program. We will continue to offer seniors and their families the ability to connect remotely, because we've seen the value of these to our residents and tenants. Thank you.
Thanks so much. I really appreciate the presentation, and it's really great for us to be able to hear about some of the work that you're doing and all of the work that you were able to do to pivot during the pandemic. And I think some folks were commenting on some of the differences in your context and what we had here, and it's great to chat about that. So we can go to some questions now. Oh, and yes, I was just also commenting on, it was great to hear about some of the technology, the ways that you were able to use technology and to support the residents and the tenants. So we can maybe get Andrea and Jill to jump on here, and we can do some questions. So we're going to go for 10 more minutes, and then we have a 15-minute break. So thanks again for everyone for engaging with us in the chat and in the Q&A, and I will turn it over to some questions now. So the first question, I think, is just a clarification question, and I can the first, Jill or Andrea, can you kind of clarify the roles in the new service model? I'm just going to paraphrase the question, but the care coordinator role and who are they employed by, and then the new support service coordinator role, who do they work for? I think the person was just looking for some clarity on whether that's kind of with the health sector or a TCHC employee, and then they were also looking for a bit of kind of context of kind of what skills and background you're looking for the TCHC side of that employment question.
So Andrea, why don't I let you start with the description of the care coordinators on the health partner side, and then I can jump in on the senior services coordinators.
Yeah, sounds good. Yeah, so the healthcare or the care coordinators are actually provincial, like Ministry of Health staff. So they are connected to the provincial healthcare system. So they don't actually report directly in through into Toronto Community Housing. And this is something that, really is part of the whole siloed nature of health on one side and housing on the other. We at the City of Toronto are not holders of personal health care data. We're not part of the care circle of care and so on. What we are is holders of building related health. So the health of the building. So we can look at things like, excessive clutter or pest issues or cleanliness or, eviction rates of eviction or safety issues. And those are the kind of indicators that we are going to be looking at to evaluate the integrated service model. But the care coordinators themselves are funded by the provincial government, and they're regulated health professionals that are trained in case management. So those case coordinators or care coordinators work directly with senior tenants to assess their health and social care needs, answer their questions, determine what health services they require, and to develop a care plan to coordinate access to basically home and community health care support services. Over to you, Jill.
Great. Thanks, Andrea. So the seniors service coordinators is the new role that I mentioned in the presentation, which is, as I mentioned, it's a role we combined kind of two positions into one because, tenants every day in their buildings, they don't distinguish between one person and another in terms of what issue they might have. So this role is really intended to be there to actively, interact with tenants and be a tenant-facing position that works directly out of buildings. They'll have dedicated time in buildings every week where a tenant can book time to see them, or they will reach out and interact with tenants to really build stronger relationships with them and to make those connections to the service providers that Andrea is speaking about. So again, these coordinators don't have access to people's individual health information, but they will help tenants get access to service and supports. And directly, build a relationship on a building by building basis with tenants to try and make it easier, to give supports and get access to supports, particularly for those that may not have, family or close friends that are checking in on them, et cetera. And so that's kind of the distinction between the service coordinators and the care coordinators with the health partners. The skills of the service coordinators are really quite diverse, to be honest. I mean, many of them come obviously from a social housing background, or that expertise is helpful. Also having an understanding of health care support systems and the health networks. And so there's a bit of a diverse background there, but certainly experience in tenant facing and social housing with a strong understanding of the healthcare system and the supports and the community partners is an asset to people in that job.
Thanks so
much. And if I could just add one more thing, Emma. So this is ISM was created was that they're in these Toronto Community Housing Seniors buildings. You have all of these care coordinator, all these health related staff coming into the building. And then you have the housing staff coming in and out of the building. And, you know, the senior tenants themselves are, you know, seeing a lot of activity in the building, a lot of people in the building, yet at least from our perspective, the health of the building overall may not be improving. So the ISM creates a mechanism and a framework within which the health staff know who the housing staff are and can have conversations with them, participate in joint training opportunities, and just have a tighter relationship. Because back to Sanders' point, you know, without relationships, really nothing is possible. And with relationships, anything's possible. So a lot of the ISM is about trying to foster greater ties between the health staff and the housing staff, notwithstanding that, you know, constitutionally, one is a provincial responsibility and the other is municipal.
Thanks so much, both. And the next question is, and I think this could be applied to both the presentations, and maybe we'll start with you, Shanika. Do you have any advice if other folks were looking to embark on adopting similar types of models in their communities that you would want to share?
Okay. So I would say I think what they're doing at Toronto Housing in terms of looking at your context is very important. So it is fundamentally important to understand your context and your operational lens. And as well, it's to talk with your residents, to talk with your clients to see what their needs are. Because so for us, when we looked at, so our community support program is staffed by persons who come from social service type backgrounds, so social workers particularly. And we had a lot of conversations with our staff about, not staff, the residents and tenants, about what would this look like? Well, how could they help? In terms of what are some of the things that you would want them to help with. And we had to be, so there are elements of things that we can't do anything about. So our folks are employed by us. They don't touch health any at all. But one of the things that we heard very clearly was the need for that connection with health. And so in terms of those relational pieces, it was important. So I would say to talk with the people who you're ultimately going to serve. As I said, the landscape is changing very quickly in terms of your clientele, but you need to start by talking with them anyhow.
We can we'll maybe move on to another one because we're plowing through our time here a little bit. There was a question in regards to intergenerational interactions with the creation of the new Seniors Housing Corp, and I wanted to expand on that a little bit. And Shanika, maybe you could speak to it as well in your models and if you have any programs. But maybe I can turn to Andrea and Jill and see if you just have any comments on how we've heard other folks talk about it throughout our conference, the importance of intergenerational programming and interactions, and the City of Toronto has some programs with relation to that. So just if anyone wanted to comment on intergenerational programming or interactions and how we can continue to facilitate that through all of these models and all of the work. So just turning it to anyone that wanted to speak to it. Andrea, did you want to jump in first?
Sure. Yeah. So some seniors prefer to live in seniors only environments and some don't. And, you know, we in the environments that are predominantly seniors. So in Toronto Community Housing, those are in the seniors buildings are generally like age 59 and up. We recognize the importance of intergenerational interactions. And so there's a lot of effort to bring programs into the building, like cyber seniors, for example, to create deliberate opportunities for those intergenerational interactions. You know, just saying that we recognize it's a challenge and it can be a barrier and something that we need to be very deliberate and conscious about ensuring that we create those opportunities where they don't exist.
Yeah. So
Yeah, and
for
oh, sorry,
oh,
go ahead, Shanika, go
oh,
ahead.
so for us, it is very embedded in our programming. So we have what we've done with all of our buildings is where, and this was pre-COVID, it has become a nightmare with COVID for in person, but pre-COVID, all the communities where a building existed, there was a connection to the school that was in the community. And so whatever the school was, whether it was an elementary school or a high school, we reached out and there was some programming going on. And so what we also did was that we tapped into partners in the community that were focused on intergenerational programming to see how we could dovetail our seniors into those programming as well. And one of the other areas that we've always done is we've pulled a lot in terms of, so we have U of A right smack in the middle of the city here, and we pull a lot of students out of U of A. We have placement opportunities for students so that they can come and work because it's a fresh face from our staff and it's a different demographic as well that's coming in. So it's through some of those that we've worked on intergenerational engagement.
I don't know if you had anything you wanted to share or add.
Yeah, I just wanted to add to Andrea. So I would definitely say, I mean, as Andrea highlighted, in Toronto, we have a distinct separation in the population, right? We have seniors who live in seniors buildings, and we have seniors that live in the family portfolio at TCHC. Many seniors, in fact, I would say there's as many seniors in family buildings in terms of the number of tenants as there is in seniors buildings. So it's a 50-50 split pretty much between those that choose to live with their families or in the community as they do in dedicated seniors communities. From an intergenerational perspective too, I would just say, to complement what Andrea said, we continue to look at, in the context of the ISM, programming opportunities to bring intergenerational involvement. And as we talk, as an example, about our relationships with the Toronto Public Library and Vickery's team, we're looking at some great donation programs through Toronto Public Library that will bring intergenerational programming to our buildings with things like digital literacy and digital programming and that kind of thing, which brings young people into programming, into buildings, and getting both seniors tenants and young people, other generations, connecting together and talking about their lived experiences and actually learning from each other. And so that's just one example of many. But yeah, I would say we continue to focus on that because it's a very important and relevant aspect of the work.
Great to hear about all of that, because we know it's definitely something that's been reflected on by many of our participants, and we know that it's definitely an important area for seniors and for young folks. I just want to, we're going to wrap it up, but there was just a really quick question, Shanika. I don't know if I don't want to put you on the spot, but and hopefully this might be a quick answer, but would you be able to share the tool that you use, that the organization uses to conduct the social assessments? And maybe that's something you could share with us, to share with some participants that might be interested in how your organization does that.
Yeah. So the social assessments are only done for the outreach workers, and or Edmonton Seniors Coordinating Council, they have a toolkit for outreach workers. And so that's what we use. So I can send it to you and you could share it. But if you go on their website, I do believe it's there. It's the Edmonton Seniors Coordinating Council.
Wonderful. I think it would be great if you could send us that, and maybe we can share that resource with folks that might be interested. Yeah. So with that, I apologize that we weren't able to get to all the questions. Once again, I believe all the presenters would have shared their contact info. If anyone doesn't have info and needs to get in touch, you can get in touch with me or any of the organizers. We really appreciate Andrea, Jill, Shanika, thank you so much for your time today. Thank you so much for sharing with us. It's been great to hear about the models and all the work that's happening, aging in place, and the innovative work that's happening across Canada. And thanks to all of our participants for joining us. I'm just checking my notes here to make sure I don't tell folks the wrong thing. We are going to take a break now for 15 minutes, and then we are going to be coming back. We're taking a 15-minute networking break, and we're going to be returning to the main room. So you can just leave this session. This session will end, and you can just click on bottom right hand corner of your screen to get back to the main room for the for the results of our student poster competition will be the next session. So thanks again for joining us, everyone, and have a great afternoon. We'll see you later.